Good morning, everybody, and I will thank Professor Muhammad Muqdadi to invite me to participate in this important conference. And now we will talk about management of autism benefits and drawbacks. Autism spectrum disorder, ASD, manifests in early childhood and characterized by qualitative weakness of social interaction, weakness of communication skills, and repetitive behavior, interests, and activities. What about rates of autism? In 2029, the CDC released data showing a record-breaking increase in rate of ASD. The CDC attributes this increasing to improvement in diagnosis and identification of ASD. Prevalence rates of in 144 children. 40,100 individuals in the USA have ASD. A global prevalence 10 to 15 per 10,000 population worldwide. Now, what about gender of ASD? Estimate of the prevalence of ASD vary widely by sex. 26.6 per 1,000 boys and 6.6 per 1,000 girls. So ASD prevalence was significantly higher among boys. What about causes of ASD? Genetic studies have contributed to our understanding of the inheritance of ASD. Susceptibility to ASD is likely associated with 400 to 1,000 genes. Heritability plays a role in 74% to 90% of the risk of the ASD. Increasing risk for ASD independently associated with maternal age of 40 years and older, paternal age of 50 years and older. Interpregnancy interval less than 24 months. Maternal rubella is associated with significantly higher rate of ASD and other conditions in children. What about familial and genetic factors? Familial factors influence in the risk of ASD. Rate of ASD in children born into families that already have a child with an ASD 18.7%. Girls born to family that has a child with ASD have 2.8 times in the risk of having such as the disorder. The risk is twice as high in children born to families with 2 or more children with an ASD. Now, the children with ASD have many signs and symptoms, and now we will present them. Development regression. Twice, weakness in social interaction. Third, weakness in communication skills. Restricted and repetitive behavior, interest, and activities. Fifth, insist on routine. What about regular screening? Early detection of toddlers for symptoms and signs of ASD is crucial because it allows for further evaluation and treatment. Siblings should be undergo screening not only for autism symptoms, but also for language delays, learning difficulties, social problems, and depressive symptoms. What about management of ASD? Individuals with ASD typically benefit from behaviorally therapeutic program developed specifically for this population as soon as the diagnosis is suspected. What about gastrointestinal disorder and autism? GI disorder, particularly constipation and chronic diarrhea, are common in children with ASD. The risk of GI disorder increase the severity of ASD symptoms. Parents report significantly more GI problem in children with ASD, 42% compared with the unaffected sibling, 12%. The two most common GI problems in children with ASD were constipation 20% and diarrhea 19%. What about problems? Children with the ASD have many problems with eating, and now we will present them. First, food that are predictable may be preferred. Prefer food that are high in sugar and fat and little or not fruit, vegetable, fish, or all grains. This can lead putting on weight, constipation, and they may be a risk on nutritional deficiency. A very limited intake. For example, eating less than 20 different food can be quite worrying. It may again lead to nutritional deficiency, which could affect weight and overall health. Now, what about alternative diets? This highlights the importance of assessing diet as a part of routine healthcare for all individuals with ASD. We know that the use of alternative diet is common among parents of children with ASD. While many of these diets are safe, they have potential for nutritional deficiencies. What about food behaviors? To 70% of parents with children with ASD report a problem with excessively narrow eating habits. Often, the tendencies continue to adolescence and adulthood. Once you convert the medical issue aren't behind a child picky eating, you should keep one basic rule in mind: avoid making food a source of conflict. Many children with ASD dislike trying a new thing, neophobia. If a child seems afraid or worried of new food, think of way to manage this anxiety. You could suggest that the two smell it and or touch it. Sometimes it helps to have a child mix the new food with the familiar and preferred food for this first test. It's also important to give children many choices, as possible as they can feel in control or of their meals. For example, say you want your grandchild to eat vegetable instead of demanding that he eating peas, give him three choices: peas, carrots, or salad. Now, what about sensory difficulties? Some kids on the ASD have sensory difficulties with the food that go beyond flavor. For example, a child may dislike the way of cherry tomato turn from solid squishy in her mouth, though she likes the flavor. It can be difficult for children to separate out that good taste from that disturbing texture. Explore creative solution for managing the sensory concern. What about gluten and casein-free diet, GFCF diet, for the hypersensitivity? Gluten is a protein found in a wheat, rye, and barley, and food made from them. Includes bread, pasta, and breakfast cereals. Casein is a protein found in cow, goat, and sheep milks, and food made from them. Include cream, yogurt, and cheese. Some people report feeling better when removing this food from their diet, but there isn't any sufficient evidence to support that at this moment. National Institute for Health and Care Excellence, NICE, advise not to use exclusion diet such as GFCF diet, as you may miss out on certain nutrients. In children, this may lead to weight loss and affect their growth. If you would like to follow a GFCF diet, then it is important that you speak with a dietitian to ensure a nutritional balance. Now, what about alternative or complementary therapies? Families frequently turn to alternative or complementary therapies as well as the medical and behavior treatment. And in this context, dietary therapies, especially elimination diets, are seen as the alternative. Some studies have shown that behaviors have improved with the nutrient elimination, and they have deteriorated when exposed to the same nutrients again. For example, in some studies, GFCF diet have been shown to be successful in improving symptoms of autism, and whereas the other have reported that such diets have no effects. What about gluten-free, casein-free diet, GFCF diets? Although it is predicted that diet therapies may improve microbiology, composition, and toxin production, studies haven't clarified this yet. Studies have been shown that this specific diet involved with the ASD will contribute to better course of the children. GFCF diet is one of the diet frequently administered in ASD. It was suggested for the first time in the 1980 that consumption of food containing gluten and casein might cause autism, like symptoms by altering brain function. GFCF diet is an elimination diet that involves the removal of some protein from the normal diets, such as gluten and casein. Digested peptides crossed intestinal mucosa of permeable intestines, frequently observed due to the formation of abnormal process resulting from immunological factor or lesion. Peptides entering the bloodstream, and then they then reach the central nervous system and have negative effect on attention, brain maturation, social communication, and learning. When the peptides level increases, brain functions are affected. Their high level play a part in the occurrence of symptoms such as loss of eye contact, impairment, hyperactivity, stereotypic movement, and self-mutilation. A hypothesis has been proposed that the diet utilized for this purpose can improve learning behavior, social cognitive function, and communication skills. Based on the hypothesis, the GFCF diets utilized to reduce ASD symptoms has alternative treatment methods. However, there is no sufficient evidence of this yet. Now, what about GFCF diet in practice? In 18 European countries, it was determined that 13% of children with ASD were on the GFCF diet. In review conducted on the GFCF diet, it is reported that dieting studies in the literature have various methodological limitation, and the number of quality of the study are insufficient. Parents of children with ASD who were on the GFCF diet stated that at least one GI symptoms decrease in their children. While some parents said their children concentration and attention increase, whereas the repetitive behavior specific to the degrees. And diet should be applied for longer period of time so that its positive effect can be seen. Now, what about risk of GFCF diet? In many studies, it was found that there was no difference in the intake of macro and micronutrients in children with ASD who were on the GFCF diet. Low bone mineral density. It is reported children with ASD have low serum folate and vitamin B12. Inadequate consumption of dairy product and GFCF diet have been found to be associated with the high level of homocysteine. Now, what about healthy nutrition plans should be applicable? Care should be taken to establish an appropriate nutrition plan for children with ASD who do or don't elimination diet, and to provide educate in information and training program to the family. Dietitian require a long time to educately describe GFCF diet. In addition to teaching that requirement of the diet to patient, generally accepted healthy nutrition plans should be applicable by the patient in order to provide and educate and balanced nutrition. Now, what about GFCF diet challenges? GFCF products are more expensive by 2040%. GFCF diet causes social isolation. Now we will talk about summary. Studies in this field are quite insufficient in terms of quality and quantity. Since the methods of these studies are different from each other, it also made it difficult to interpret. In addition, while evaluating behavior changes, it was adhered to their parent statement by not using objective methods. The most widely accepted one in the opioid theory. There are a few studies that demonstrate the GFCF diet has a beneficial effect to support the opioid theory. Since the studies are generally applied to a small number of subjects for the short period, the effect of diets on ASD behavior isn't clear. Long-term administration of restricted diets such as GFCF diet may cause the micronutrients deficiencies. It should be taken into consideration that restricted diets may cause the economic burden on families, sign social isolation, and have social and psychological consequences. What about recommendation? Further research if the effectiveness of the diet for children with ASD are needed. Work to maintaining healthy and balanced food for children with ASD. Work to maintaining healthy and balanced for children with ASD. Thank you for listening.